Hey guys, so sorry I haven't done a vlog for a while, but a few of you have told me off, so here I am updating you on my surgery for breast cancer. So as you know, I opted to have a skin sparing mastectomy to my right breast, and as you can tell, they're sort of looking the same right now, and that's due to the reconstruction process, which has been going on for about 6 weeks post-op. What happens is there's a port that was placed at the same time as my operation under the skin, and I go to my surgeon every week on a Thursday at the University College London Hospital, where he injects the port into the breast, the implant that's inside. He injects a saline solution. So when I actually had the mastectomy and the implant was placed in, it was a half to a third full with fluid already in there, silicone. And then there's a separate chamber. It's called a Becker implant, by the way. It's supposed to be top notch at the moment, as it doesn't have to be replaced. The whole idea between gradually inflating the breast over a period of weeks is that it will gradually stretch the skin to accommodate for the implant, and by doing it gradually, it doesn't hurt, it's not uncomfortable, you know, your chest doesn't feel too, you know, taut there and strained. So it's been, I won't say easy, because, you know, that's not really an appropriate word, I think, but it's not been as bad as one would expect. I'm quite pleased with the appearance of the breast. As you can see in a bra, no one could tell, you know, any different to the healthy breast. They're, you know, they're looking the same size. I've got 2 more sessions of inflation left, because my surgeon wants to overinflate the implant, as I'm due to have radiotherapy after Christmas. And you know, sometimes having the radiotherapy to a reconstructed breast isn't usually something that a lot of surgeons would choose to do. They're used to just leave the, you know, chest flat on the side where the mastectomy was performed, and then do a delayed reconstruction after radiotherapy. But in my case, I'm young, you know, I don't want to, you know, I still want to have my cleavage. You know, he was pro having the immediate reconstruction even though I'm having radiotherapy, and the only downside is the radiotherapy might make the implant goes a bit smaller or a bit harder. I've been reassured these things aren't a problem. One, because we're overinflating the implant anyway, so if we lose a bit of volume, it's not going to be a huge problem. And I'm also going to be having a half a boob job on my left side, to reduce that boob, give it an uplift, which lots of women, you know, quite pleased about that. Which, you know, I'm the first to admit, since I was young, I've always been a bit self-conscious about having big breasts. You know, they're not held up by gravity, you know, they're not perfectly pert like a size A cup would be. So I get to have the healthy breast reduced and uplifted, so it'll match. So like as I was saying, if the right breast does get a bit smaller, it's not going to matter, because we're reducing this one in a couple of months to match. As for it getting harder, that's something that can be fixed in surgery, and I will be having more operations, that's inevitable. So it's not like I'm trying to say, you know, worrying about saving myself operations, because I'm due to have more, one being the nipple reconstruction, which again will be in a 5-6 months time period. So if you want the exact word for what I had, it was a left reduction pattern skin sparing mastectomy with axillary node clearance. Now, to mention the axillary node clearance, obviously what I was saying was that the lymph nodes were affected. So when I first had my test on them, quite a while back now, they were tested. There was 4 taken away first, and 2 of them had cancer. Big boo, rubbish, because it meant, you know, it was spreading. But I was so nervous to go and get my post-surgery results, because obviously I had the clearance, I had all my axillary nodes taken out, and they figured at the end of it that there was no more involved, so the cancer was stopped in its tracks and it's been all taken away now. So I was obviously naturally really pleased about that. Still, I'm having a radiotherapy because we want to check the skin's okay, and because the nodes were involved originally. So anyway, I said to you it was on my right side. It's actually on the left, and that just shows you how, you know, I can't tell the difference here looking at myself in the camera. They look the same to me. Yeah, so I won't sit here fondling my breasts. The left's the one that's having the reduction, the right was the mastectomy, just to make that clear, so we don't get confused. But, you know, I think we can all agree they're looking quite good. The scarring's not bad at all, it's settling down, and nipple reconstruction at a later date, so things are all good here. I'm just looking forward to Christmas now and spend it with my family and friends, so happy Christmas to everyone else. Bye.